Just like there was a higher probability of Novak Djokovic drowning than dying of a COVID infection, the chance of injury of such a child is much higher than the child dying due to COVID. We have allowed panic to blind us and cloud our judgment that our actions now in shutting schools and not allowing our children to access school education impairs them for life. Hi, I'm not afraid of sending my daughter to school. She is a little over 3.5 years old. I was listening to an interview with Dr. Skoldorf and Bhattacharya on the risk and infectiousness on children in the SARS-CoV-2 pandemic. Dr. J. Bhattacharya is a professor of medicine at Stanford University whose research focuses on the economics of healthcare around the world with particular emphasis on vulnerable population. His peer-reviewed research has been published in economics, statistics, legal, medical, public health and health policy journals. Dr. Martin Kulldorff is a professor of medicine at Harvard Medical School. He is an expert on infectious disease outbreaks and has worked with Center for Disease Control and Prevention. He has developed statistical and epidemiological methods for the early detection and monitoring of disease outbreaks, currently used by many public health departments for COVID-19 and other diseases. Dr. J. Bhattacharya says kids face lower risk of mortality due to COVID. More kids die from the flu than from COVID. In Sweden, there have been 0 deaths even though children went to daycare and to school. In Sweden, children right from the age 1 up to 15 went to school. They had more outdoor time in schools, no mask use and no distancing. What are we trying to protect our children from by not sending them to school? From infection? Would children probably get infected if we sent them to school? Maybe from the school, maybe from if we go outside, maybe from elsewhere, maybe from family members. Children may get infected. Just like they might get infected and get a common cold, they might also get the corona flu. It could happen anywhere. Could it happen from schools? Maybe. Dr. Martin Kulldorff says, even if they get it, they will have very mild symptoms and hospitalizations are extremely rare. And I believe it, that they will have very mild symptoms because that's what happened. Our family, including my daughter, got infected. I'll speak to you in another video about it. It was near to nothing. Dr. Martin Kulldorff says that in schools, if people get infected, it's because staff to staff and staff to student transmissions are higher. There is very less student to student transmission and student to staff transmission. The New England Journal of Medicine says that children are very less likely to pass on the infection to adults. Children infections are one of the least likely that would infect vulnerable individuals. We see data repeated over and over again, and we hear reports saying that children are very less likely to be affected. I don't see any reason why I should not send my daughter to school. I don't see any reason why I should be driven by panic and blinded by fear and kind of numbed and paralyzed by fear. I'm not afraid to send my daughter to school. Just like there was a higher probability of Novak Djokovic drowning than dying of a COVID infection, there is a higher possibility of a child dying from a road accident or an injury than dying of a corona infection. I see so many parents, educated parents, taking their children in their car without a child safety seat. They haven't invested in a car seat for their child. They love their child with all their heart, but there is no car seat in the car. The child sits in an adult seat. The child sits without being harnessed by a seat belt. The adults sit in the car without being harnessed by a seat belt. I so often see on the highway, the level of dumbness amazes me. Parents letting their children stand on the seat so that they can look through the sunroof. The sunroof is to let the sunlight in, not to let the child stand and look out. And I saw this on highways where the parents are traveling at about 80 to 100 kilometers speed. The chance of injury of such a child is much higher than the child dying due to COVID. So I really think we should have a sense of perspective of what safety is and what we can do to protect our children, and what infection is, and what the numbers speak, and what data says, and what science says. I haven't stopped sending my child to school when the cold was spreading. One child gets it, and then another child gets it, and another child gets it, and they have it for a few days, and that's it. That doesn't stop any of us from sending our children to school. So why should this stop us from sending our children to school? Somehow we have allowed panic to blind us and cloud our judgment, that our actions now in shutting schools and not allowing our children to access school education impairs them for life. I speak about how badly children are affected in another video. Go check it out. So these are the reasons I'm not afraid to send my child to school. There's also another video, why I'm not afraid of corona. Go check that out as well. If you like this video, please click or tap the like button and subscribe and click on the bell notification if you would like to receive further videos from Indian LCHF. Thank you.